Welcome back. February is American Heart Month, and today is Go Red Day. We are wearing red to support the American Heart Association's fight against heart disease in women. Dr. Shawn Sanders is a cardiologist at Baptist Medical Center. He joins me today to talk to us about this disease. We're so glad to have you today.
Well, thank you for having me.
Well, so we do know that heart disease in women it's a great health threat for women. Can you tell us why that is?
So heart disease in women is the #1 killer of women, and 1 out of 3 women are affected with heart disease, especially in the Southeast. Everyone, either they're a patient, friends or family have been affected by heart disease, and women especially. My theory, what I tell patients, I'm convinced women are tougher than men, but women are more affected by heart disease than men. They can have more atypical symptoms. Oftentimes they do not seek medical care as quickly. They get referred less quickly than men and have worse outcomes in the hospital. So it's an important month. February is Heart Month, and we try to do an extra good job of raising awareness for women in particular.
And you're encouraging women to take charge of their health. What are, you said, some of those symptoms? What are some of those symptoms that, women may need to look out for in order, to get checked up or come to the doctor?
Right. Well, certainly chest pain. Women, that's the #1 symptom for women and men presenting with myocardial infarction or angina. But we also look for what are called anginal equivalents. So it could be, I tell patients, shortness of breath, or if they are active, if they all of a sudden notice a difference in their exertional capacity. If you walk half a mile most days of the week and then all of a sudden you get short of breath doing that, or walking to the mailbox, any change in your activity level or how much you're able to do, you should think about the heart first. It's the heart until we prove otherwise.
Can you talk about the risk factors? Are the risk factors same in women and men?
Yeah, so risk factors are universal. I tell patients there are 2 things in life that you can't, as far as heart disease, there's 2 things in life you cannot control. It's how many birthdays you've had, and birthdays are a good thing. That's the goal, right? And then also family history, so genetics. So genetics plays a very strong role. So it's important knowing, what medical problems your parents have had or siblings. And if they have early heart disease running in the family, I think that's a big reason to go seek, early preventative medical therapy. Other risk factors would be inactivity, eating unhealthy, certainly smoking and diabetes. But all of those things are factors that you have a fighting chance. You can be more active, you can eat right. If you're a diabetic, get your diabetes under better control, with a physician. Certainly don't smoke. So yeah, those are common risk factors for both men and women. And
that's what I was going to ask. You were giving some of the ways that you can obviously prevent heart disease. How can people protect themselves, and what is one of the main things that you're trying to drive home to people during this month?
Yeah, I think the big thing is activity level. I tell my patients 30 minutes 3 or 4 times a week. I certainly love more than that, but studies have shown less than 1/5 of patients abide by that. So we all have rooms of improvement for improvement in activity level. We all can tune up our diet more in a healthy way. Studies have shown that the Mediterranean diet or the heart healthy diet is good for heart disease. It also helps prevent dementia. My wife is a geriatrician, and so that has it's a big importance for both of us. And so yeah, eat right, stay active. I think patients with a family history, it's important to go see a primary care doctor, or if you had a family member die from early heart disease, see a cardiologist.
All right. We thank you so much, Dr. Sanders from Baptist Medical Center, for joining us today and talking to us about Go Red Month, Go Red Day, and just how you can have a healthy heart. Thank you so much.
Thank you.